tonight.
I really needed to use the bathroom more times than most people do. I carried big thick towels, a change of clothing in my car. I just thought that I was going to have to spend the rest of my life like that.
An ABC 27 special presentation.
I wasn't able to be up on my feet, go shopping, or do anything that I normally do.
Women, Here's to Your Health, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Deborah Pinkerton. Tonight we're going to talk about a number of women's health issues, from breast cancer to a problem of coughing or sneezing and having an accident. Specialists from Penn State Hershey Medical Center are in the ABC 27 call center to answer your questions. Call the number on the bottom of the screen, or you can email your question during the show to questions27@abc27.com. Specialists will answer your emails throughout tonight's show. All calls and emails are confidential. Bladder control problems can affect women of any age, but most women are embarrassed to talk about it, even with their doctor. 25 million adult Americans experience transient or chronic urinary incontinence. On average, women wait 6.5 years from the first time they experience symptoms until they obtain a diagnosis. 2/3 of individuals who experience loss of bladder control symptoms don't use any treatment or product to manage their incontinence. And this was the case for a Cumberland County woman. For years, she searched for answers and solutions for her urinary incontinence. Ruth Brommer and her husband Bob can finally enjoy their backyard paradise. Ruth no longer has to spend most of her time indoors. For years, a bathroom was her best friend.
I really needed to use the bathroom more times than most people do. And I was aware that something was going on, but not anything that I thought was an illness. Nothing, that sort of thing.
Ruth realized it was more serious when she couldn't make it to the restroom in time.
The leaks at first were small, and you could get by with it, but as time went on, I had to wear pads constantly, every day. Not big, thick ones, but I had to have protection every day.
When we would go out, we were sitting at dinner or something, and she would have to leave the table, and so it becomes very apparent that there's a problem.
I carried big thick towels in my car. I carried a change of clothing in my car, and in my purse at all times were panties and extra pads. I just couldn't go anywhere without it. It got to the point where I was changing clothes 2 and 3 times a day. There was no way that I could get to the bathroom in time.
When she would have accidents, then I would help to take the wet clothing and put them in the washer, and just generally try to make things a little bit easier for her.
Ruth tried several medications, surgical procedures, and behavioral therapy to treat urinary incontinence. Nothing seemed to work.
I just thought that I was going to have to spend the rest of my life like that.
Urologist Dr. Vanessa Elliott knew she could help Ruth.
So in Ruth's case, when I met her, I really wasn't for certain what type of incontinence she had, but by her description, it sounded like an urge incontinence issue.
And she said, I want to do testing, and I thought, but I did it. I'm glad I did it, because she was able to determine from her test exactly what the problem was.
So she had a cystoscopy as part of her workup, which is where we look into her bladder. The other part of her procedure was a urodynamics evaluation. And that's a study that we do mostly for incontinence patients. And that just basically gave me the answers as to why she was having incontinence.
She said that this is called urge incontinence. And the normal signals that come from the brain down through the sacral nerve were not normal for me anymore. They were very, very scattered, and they were giving me signals that just went bzzzt all over the place.
Dr. Elliott said this small device was the answer to reconnect the signals.
InterStim, it's a device that's been around for a long time, It's a pacemaker device, very similar to a heart pacemaker. However, it works by basically modulating the nerves between the brain, the spine, and the sacral nerves that go to the bladder. The exact pathway is unknown, but it works to kind of get rid of any hardware glitches that exist between the brain and the bladder. And we put a small electrode in next to one of the sacral nerves, which is not in the spine, it's in the tailbone area, so there's no risk of any spinal injury or anything of that nature. We go ahead and we put the electrode in, and for a week to 2 weeks, they trial the device. So that means that they wear a small battery clipped onto their waistband of their pants for that time period.
During that trial period, InterStim worked for Ruth. It cut down her leakage by 70%.
If they came back with greater than 50% improvement in their symptoms, we go ahead then we get rid of the battery pack that's clipped on their waistband, and we go ahead and internalize everything. And typically the battery, it's something that's almost like a silver dollar type size, and that gets placed into the buttocks area in a small incision.
I have a little control that fits into my hand that I can change the impulse, I can change the program to move it somewhere else. I've got complete control of this.
A little gadget that has given Ruth a little tenderness in her life.
I don't have very many leaks at all anymore. I have a definite urge when it's time to go to the bathroom. I can get up and go to the bathroom and not have to run for it or think that I'm not going to make it.
I can see the change in her. I mean, she has a smile on her face. She's just very, very, very happy. And it makes life a lot easier for her.
I just can't tell you how much better my life is. I am so happy with this. It's just unimaginable compared to what it was. It's just wonderful now.
And she is much happier now. Ruth says she finally told her friends about this, and it turns out some of them share similar problems. Now joining us tonight is urologist Dr. Vanessa Elliott. Ruth had urge incontinence. What causes this?
Sure, urge incontinence can be caused by a variety of issues, but common things might include a neurologic problem, infections, inflammation in the bladder. There's a whole host of issues that can cause this problem.
She had the InterStim device. It seems to be working well. What other treatment options are available?
Sure, so most patients really don't start with InterStim as their therapy. They start with something more conservative. Typically that can involve physical therapy or biofeedback therapy, even behavioral therapies. After that, a lot of them will move on to a medication that can be a tablet or a cream or a patch. And then if they don't do well with those therapies, then InterStim would be an option for them, or something like Botox injections.
I'm sure a question many people may be wondering, what about insurance coverage?
Sure, so insurance coverage, typically most insurances will cover it, but you have had to have failed those conservative therapies first. You also have to keep a diary during that trial period for the device, and you've had to improve by at least 50%.
And now what other types of urinary incontinence? We spoke about urge. Are there other types?
So urge incontinence like Ruth had, that's typically described as I need to get to the bathroom and I can't get there in time. And the other common type of incontinence is what we call stress incontinence, which means you laugh, you cough, you sneeze, exercise, you have incontinence. And there are some other more uncommon types of incontinence as well.
And some people may be watching and wondering, when should I contact my doctor?
Sure, I guess my advice would be is if the symptom is bothersome for you, you should contact your doctor. It's a sensitive issue, but so many people have the problem that you really shouldn't be uncomfortable contacting them for an appointment.
Okay, we did get a viewer question, and this is what it is. It says, I'm 44 years old and have had bladder problems since I gained weight over the last 5 years. Would weight loss solve my problem? Are there any foods I should avoid?
Sure, so for weight loss, there are studies that show that if you can lose even 5% of your body mass, that you will have an improvement in both stress and urge incontinence symptoms, so weight loss is key. Foods, definitely certain things to avoid, so caffeine, alcohol, those are the two big ones, and also for some patients, acidic foods like citrus are good things to avoid as well.
Okay, some very good information. Thanks for joining us tonight.
Thanks for having me.
We can check in with the phone lines. You can see they are busy. The number to call, 717-346-3333, or you can email your question to questions27@abc27.com. Stay with us. We will be right back.
You're watching Women, Here's to Your Health on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. In the first part of our show, we discussed different types of urinary incontinence. Now we're going to move on to another problem women share, rectal prolapse. This is a condition a Lancaster County woman developed.
Nancy Weaver takes advantage of beautiful days like this one. Now she enjoys exercising in the pool, but a few months ago she couldn't.
I wasn't in the pool that much. I usually would sit on the edge and have my feet in, but I wasn't in completely.
That's because Nancy had a tough time standing and walking. She thought she had a common condition.
When I first had the problem, I thought it was hemorrhoids and only a slight problem.
But that slight problem didn't get better.
This just kept getting worse and worse to the point where I wasn't able to be up on my feet or go shopping or do anything that I normally do.
She's really active, and we would go out and she would be like, I can't, I have to go sit down, I have to sit down.
Well, come to find out, when I went to the doctor and was examined, she said no, that I had a prolapsed bowel.
So she had about a 7-centimeter prolapse of her rectum coming out of her anus. It would easily reduce, meaning that it would go back in, so it was not a need for an emergency surgery. It can be very painful because you have something in between your legs and you're sitting on it. A lot of patients say they feel like they're sitting on a ball, and it can be painful and affect their daily activities of life.
Dr. Puleo tells her residents the only way to fix this problem is through surgery.
She set up the day of the surgery and told me what time to be there.
The surgery would take about an hour and a half, and she would be in the hospital 2 to 3 days.
So for Nancy, we performed a perineal proctus sigmoidectomy, which basically is the perineal approach. And what we do is we unfold it and we take out the excess bowel and reanastomose, meaning connect the healthy bowel to her anus. And so she gets a coloanal anastomosis.
Went fine, no problems. I couldn't believe how wonderful it went.
Nancy spent 2 nights in the hospital.
You would have never known she had surgery. She came home from the hospital. I don't know if she had gone so long with this problem that it was causing her so much stress that once it wasn't there anymore, it was just like she went in, came out, and was fine. She's right back to her old self. She's active.
Feel wonderful. Made it fantastic so I could go and do what I wanted to do and not have to be sitting all the time.
And what a difference that surgery made for Nancy, as you could see. Now joining us is Dr. Frances Puleo, a colorectal surgeon who performed the surgery on Nancy. She's doing much better. Tell us, how common is rectal prolapse and what causes it?
So rectal prolapse, really, we don't know the true prevalence of it. It's probably underreported. But what causes it is really if you strain a lot to have bowel movements, but also more commonly it's due to pelvic floor muscle weakening, really from childbirth, vaginal childbirth.
Is surgery really the best treatment option?
Surgery is the only treatment option to fix rectal prolapse, yes.
And is it laparoscopic?
So for Nancy, we performed it a local procedure through its perineal approach, but you can, in younger, healthier patients, you can do an abdominal approach, which can be done both laparoscopically or robotically, and we offer all of those approaches at Hershey.
Okay, and we did receive one of our viewer questions, and it says, I've had hemorrhoids that were very painful. How can I tell the difference between hemorrhoids and prolapse?
So rectal prolapse is when your rectum comes out of your anus and it's in a circle, whereas hemorrhoids are really the natural vascular cushions of our anus, and usually that's just in one area. It's not a complete circle. But the best way to to tell what it is really to go to your healthcare provider so they can examine you.
And should the doctor or should the patient also go to the doctor for the hemorrhoids?
Yes, as well.
Okay, great. Dr. Puleo, thank you for joining us this evening. Some good advice on a topic that is somewhat sensitive to talk about. And many people, I'm sure, feel very uncomfortable talking about this.
Yes, they do.
Okay, thank you very much.
Thank you.
If you have a question for one of our specialists, call 717-346-3333. If the phone lines are busy, you can also email our specialist, nurse practitioner Christine Ardell from the colorectal surgery team, and Dr. Susan Shutter, co-director of the Breast Center, are here to answer your emails. Email your question to questions27@abc27.com. Stay with us. We will be right back.
Women, Here's to Your Health on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. For the past 5 years, we have talked to numerous breast cancer survivors. You have seen their courage, their strength, and their hope. Here's a look back.
I was in the shower one day, looked down and noticed a change in the shape of my breast. My head started to spin, and he said to me, "You need a biopsy." And she said, "Yes, you do have breast cancer, and it's a good size."
It was about 2 centimeters in size.
And I then decided that I was going to do a double mastectomy. I feel I got a new start. I got a new lease on life. I'm healthy.
Doing a self-breast exam, noticed that I had a lump. They said, "No, I think we need to biopsy it."
The biopsy showed that she had a cancer in her breast.
So I was really pretty set, like, okay, they found cancer, you take this out and I'll be fine.
Well, I told her that we could either do a mastectomy or a lumpectomy, and I recommended the lumpectomy. She went on to get a oncotype recurrence score, and her score came back at 27.
I told her that there's probably a benefit to chemotherapy.
You're going to go through your first course of chemotherapy, and probably within 3 weeks you'll start to lose your hair. I feel great. I really don't even think about it anymore.
And joining us live right now are Deb Milaro and Chris Smith. Thanks so much for joining us, ladies. You look great this evening in pink.
Thank you.
Deb, why don't you give us an update? How are you doing?
I'm doing great. I am 5.5 years out, cancer-free. I've had double mastectomy with a reconstruction, and I'm on tamoxifen. It'll be 10 years that I'll be on tamoxifen. I feel fine. Very happy with all my decisions that I have made.
What helped you get through each day?
First and foremost, my husband, my family, my children, and the many people, friends and neighbors, who just were helpful. And it was extremely healing to have people send cards and bring meals and drive me places. So that's what still helps me today when I look back and I think of those times and those memories. I don't dwell on the fact that I was diagnosed so much as what it's done for me.
Chris, how are you doing? Give us an update.
I'm also doing very, very well. I'm 3.5 years out from my diagnosis, and really back, very active, 2 grandchildren, and it's been wonderful.
How is it having all of the doctors basically under one roof?
That absolutely made life much, much easier, to be able to go in and be diagnosed and have clear direction from a whole team of physicians, to be able to really feel like you were guided and well taken care of and didn't have to go multiple different locations for care.
And what advice would you give to people watching tonight who have been diagnosed and say, how do I get through this?
I think, as Deb said, I think having family support is critical. Really having a good trust in the medical care providers was wonderful. Family support, friend support really makes it possible to get through it all.
Okay, once again, you look fabulous. Keep
Thank
up
you.
the good work.
Thank you so much.
We will.
And let's check out the phone lines. You can see all of the ladies are busy. The specialists are also answering a number of questions regarding the women's health issues. The phone lines are open until 8 o'clock tonight, so there is still time to get one in. If you can't get through on the phone lines, you can email your question to questions27@abc27.com. And we do have a viewer question that did come in this evening, and here it is. Years ago, my mother had breast cancer, and after she was treated, she said she often got confused on what to do next. What types of resources are available for survivors today? Breast surgeon Christine Witters joins us now. How does the medical center help breast cancer survivors?
Breast cancer is complex, and it's more than just having breast cancer or being cancer-free. Many women, as their healthcare needs continue to change outside of treatment, often do feel lost and abandoned. In 2005, the Institute of Medicine issued a consensus statement recommending that all women receive a specialized survivorship plan specific to their needs. At Penn State Hershey Breast Center, we have a survivor clinic called Reflections, where women can get that personalized treatment cancer that focuses not just on their mammograms or on their breast exams, but also on the specific needs of those individuals and how to give them the best quality of life really moving forward.
And what are some of the challenges women experience after being diagnosed with breast cancer?
There are a lot of challenges that women face. Some specifically to breast cancer are challenges like changes in relationships during and after treatment, fatigue, emotional, mental changes. Some women experience grief, depression, anxiety. And then there's also the physical changes, such as changes in appearance, sexuality, and fertility. And those can be very overwhelming for women.
Okay, we do have another viewer question that came in. Let's go to that. I had a mammogram last month and it was normal. They also said that the breast density was high and that it makes it hard to detect cancer. Should I have an ultrasound done to make sure everything is all right?
That is a wonderful question, and I know it's one a lot of women are asking as they get their new mammogram report this year, which includes breast density. Breast density is not something that necessarily means women should get additional screening, but it's meant to open a dialogue between the patient and their provider regarding their breast cancer risk. Breast density, along with age, family history, prior biopsies, as well as reproductive history, are all things that impact their breast cancer risk. Based on those risks, they may get screening like MRIs or ultrasounds, but they should really still get their mammograms and breast exams. At Penn State Hershey Breast Center, we are shortly acquiring whole breast screening ultrasound to allow us to have an extra tool to screen those women with denser breasts.
Okay, and as Chris Smith had mentioned about having the doctors all under one roof, let's talk about how does that work?
Having the doctors under one roof, we talked about earlier today, just acts as us having the ability to pool over 20 different specialists all in the same area focused on that patient care. It really gives us really helps us to better offer them all the latest treatment options and give them a plan that is specific to their cancer and their and kind of their goals as far as treatment.
Okay, Dr. Witters, thank you so much for joining us this evening. We also want to thank the specialists here tonight for answering your calls and also your emails. We also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or you would like to schedule an appointment on one of the topics we covered tonight, certainly covered a number of them, here are the numbers that you can call. For female urology care, call this number, 717-531-8848. For colorectal care, call 717-531-5164. And for the breast center, call 717-531-5867. Now, Monday, October 27th, come out to the Penn State Hershey Breast Center for a night of health and pampering for their breast cancer screening mammo night. There will be screening mammograms and free mammograms to any uninsured or underinsured women, plus massage therapists, mini manicures, and more. Call Shauna Gillette at 717-531-4698 to schedule your appointment. We want to thank you for watching this evening, and we wish you good health.